Hello guys, welcome back to my YouTube channel, Dr. RK Medicos. Today, in this video, we will talk about the nasal septum. If you are new at my YouTube channel, then please subscribe, like and share my YouTube channel so that you will get notification of full video uploaded by me on my YouTube channel. Let's start this video without escaping the time. Nasal septum is a middle osteocartilaginous partition between the two halves of nasal cavity, as you can see in the figure, and on each side it is covered by mucous membrane and form the middle wall of both nasal cavity. As you can see in the figure that the bony part of nasal septum is formed by the vomer as well as the perpendicular plate of ethmoid. And now we will discuss about the cartilaginous part of nasal septum. Cartilaginous part of the nasal septum is formed by the septal cartilage and greater alar cartilage, as you can see in the figure. Now we will discuss about the arterial supply of nasal septum. As you can see in the figure that the anterior superior part of the nasal septum is supplied by the anterior and posterior ethmoidal artery. This is the anterior and posterior ethmoidal artery, and the anterior inferior part is supplied by the septal branch of superior level artery. This is a superior level artery and it is the branch of facial artery, and the posterior superior part of the nasal septum is supplied by the sphenopalatine artery. This is a sphenopalatine artery, and this is the main artery of the nasal septum. And one fact should be considered here is that the anterior inferior part of the nasal septum contain the anastomosis between the all branches. So that is a septal branch of superior level branch of facial artery, sphenopalatine artery, and anterior ethmoidal artery, and this is also known as the Little's area, and this is the most common site of the bleeding. And now we will discuss about the venous drainage of nasal septum. As you can see in the figure that the anterior superior part of the nasal septum is drained by the anterior and posterior ethmoidal vein. This is anterior and this is a posterior ethmoidal vein, and the anterior inferior part of the nasal septum is drained by the superior level branch of facial vein. This is a superior level branch of facial vein, and the posterior superior part is drained by the sphenopalatine vein, and this is a sphenopalatine vein, and this is a main vein of nasal septum, as you can see in the figure. Now the vein of nasal septum form the plexus, and this plexus drain anteriorly into the facial vein. As you can see in the figure, this plexus drain anteriorly into the facial vein, and posteriorly it is drained into the pterygoid venous plexus. Now we will talk about the nerve supply of nasal septum. General sensory nerve as from the trigeminal nerve are distributed to the whole of the septum. As you can see in the figure that anterior superior part of the nasal septum is supplied by the internal nasal branch of anterior ethmoidal nerve. As you can see in the figure, this is a anterior ethmoidal nerve, and posterior inferior part is supplied by the nasopalatine branch of pterygopalatine ganglion. This is a nasopalatine branch of pterygopalatine ganglion, and this is a main nerve, and the special sensory nerve or olfactory nerve are confined to the upper part of olfactory area, as you can see in the figure. Now we will discuss about the lymphatic drainage of the nasal septum. As you can see in the figure that the lymphatics from the anterior part of the nasal septum is the drain into the submandibular lymph node, and this is a submandibular lymph node, and the lymphatics from the posterior half of the nasal septum is drain into the retropharyngeal and deep cervical lymph node. This is a retropharyngeal and deep cervical lymph node. Now we will talk about the clinical anatomy of nasal septum. Pathological deviation of nasal septum is often responsible for the repeated attack of common cold, allergic rhinitis, and it requires the surgical correction. And this is all about the nasal septum.